Good afternoon to all. Madam Resident Coordinator, heads of UN agency here in Nigeria, we wish to welcome you to the Office of the Vice President of the Republic of Liberia to this consultative meeting to engage the Vice President. You are welcome. At this time, we want to ask Honorable Prince, the Chief of Office Staff in the Office of the Vice President, to brief us quickly and look at the agenda for today's meeting. Prince.
Thank you. Let me first say you are welcome, and thank you for being here today so we can share responsibility, share ideas on the way forward of our country. And throughout the meeting, I know you already have the agenda, and we look forward to all the best ideas because we believe that it is by cooperation that we can move our country forward. And you sharing your thoughts and we also doing ours, together we can form a union that is more stronger than an individual who actually lead a country. We know it's a whole lot of work, and we also depend on you for the first time to have such a meeting. I want to thank you, and we look forward to all the best ideas that we can share together to make our country better. Thank you.
Thank you.
And then we have the introduction. Each of us will have to introduce ourselves, and I think I will have to end from you. I will start maybe from the back. This way, we'll go this way.
We'll start from the resident coordinator.
No, she's
okay.
Yes.
Okay.
From right now, we end it right here. Okay. So can I start from the back?
Good afternoon. My name is McDonald Metzger. I'm the Deputy Chief of Staff here for Administration in the Office of the Vice President. Welcome.
Good afternoon. My name is Richmond Richards Nuda Senior, the Press Secretary and Speechwriter of the Vice President.
Good afternoon. My name is Manuel Felipe. I'm the Economist of President Coordination Office.
Good afternoon. My name is Augustine Musa. I'm the National Coordinator for the Security of Nutrition Movement Secretary in the Office of the Vice President. Thank you.
Good afternoon. My name is Solomon Ware, Senior. I'm the Director of Press and Public Affairs in the Office of the Vice President.
Good afternoon, Honorable Vice President. Good afternoon, everyone. My name is Dr. Musa Duwoko. I'm representing Dr. Clement Peter, who is the representative, the WHO representative to Liberia.
Good afternoon, Honorable President. Good afternoon. My name is Amadou Sisse. I'm Deputy Representative for UNICEF. I'm sitting here for Andrew Brook, the UNICEF representative in Liberia, who is in a mission now and teleworking from outside the country. Thank you.
Thank you, Honorable Vice President. I'm Christiana Solomon. I'm the Peace and Development Advisor in the Resident Coordinator's Office. Also a Solomon, but with a surname, not first name.
Good afternoon, Honorable District. My name is Christian Mukosa. I'm the representative of the UN Human Rights.
Okay, so my name is Prince Mekalo Good. I'm the Chief of Staff, Office of the Vice President.
Good afternoon, Vice President. I'm Vidisha Pillai, UNFPA representative.
Good afternoon, Honorable Minister. So my name is Kasai Tuspai. I'm the Deputy Representative for the WFP. I'm representing Ali Bien, is the country representative. He's in the Ministry of Agriculture on the National Annual Operation. Thank you.
Good afternoon, Excellency. My name is Anthony Kwaku Ohemembwama. I'm the UNDP representative.
Good afternoon, Your Excellency, Mr. Vice President. I'm Comfort Lamti, UN Women representative.
Good afternoon, Your Excellency, Vice President. My name is John Motea. I'm here for UNESCO, representing the Regional Director who sits in Dakar. Thank you.
Good afternoon, Excellency. I'm here as Dr. Jacob. I'm here on behalf of the Group 77
I will get a chance maybe to introduce and say a bit about books and excellence.
Good afternoon, my name is Melvin Sadebon, Focus President in Liberia.
My name is Brian T. Nelson. I'm the Director of Special Projects, Office of the Vice President.
My name is Christine Anthony. I'm the UNFPA coordinator.
Thank you. And my name is Mario Koung, the Vice President of
All right, thank you so much for the self-introduction. Our overview, which will be done by UNFPA in Liberia.
Thank you. Thank you very much for the opportunity to meet. This is a meeting that follows our letter of request to meet. And actually, it follows a number of engagements that you have had with some UN agencies. I know you have traveled with some to neighboring countries under the SUN program and worked on other things. And so in our meeting, we felt that there are quite a number of things that you champion or sectors that you need that look at a number of agencies. So we say that it would be good to have this meeting. Is really a sort of a working meeting, advocacy meeting, just to get to know each other's work. And sorry that 3 of the agencies are not here because the president is launching the agricultural development plan. So the Food and Agriculture Organization, the World Food Program, and IFAD are not here in this meeting. We have wished to be here because they are strongly connected to one of the pillars that you are very much involved in. But even I had to excuse myself. I made my speech and asked people to allow me. So then I'm here. So we would like to say maybe from the UN side, really, we have our own cooperation framework with the government of Liberia. And our cooperation framework will come to an end 2025. I can just briefly go through the areas where the UN is working. And this cooperation framework means that we look at the national development plan, and then we look at our own capacities. We see where we can be of some support. Of course, it's a big piece of the pie that we do, but we try to support aligning with national priorities. So for us, the national plan is critical. So for the current cooperation framework, we are working on human development and essential services. I'm reading directly from the key areas in the document itself. And this means improved rights-based, gender-sensitive quality life with inclusive, equitable access and utilization of essential services. And these will go all the way from education, health, and so on. And then sustainable economic development, meaning diversified and inclusive economic growth. So under this, sustainable agriculture, food security, job creation, resilience to climate change, natural disaster, alignment, really aligning to the economy and jobs area. Then the third is sustaining peace, security, and rule of law. And under that, really looking at consolidated and sustainable peace, enhanced social cohesion, rule of law, human rights, aligned to also the pillars on sustaining peace. So the fourth one is governance and transparency. Good governance, transparent and strengthened institutions to deliver essential services targeting the most vulnerable. So generally all governance areas, decentralization, strengthening institutions. And under all this, the different agencies find themselves working under the pillar in which they have a core mandate. And I will give them time, each one of them, to deep dive on areas where they are working essentially. So we are mostly also here to listen, ready to listen. This is a new government, and every government comes with its focus, and we know things will come clearer in the National Development Plan, but that will come from the vision, again, of the people and the aspiration of the people. And so we felt it good to come in and listen. We've read a bit of what you do. We've interacted agency by agency sometimes, but we will want to hear your own expectation, your vision vis-a-vis partnership, but your biggest areas of emphasis, so that as we work, we know that this is where it is. But we also, beyond the actual work, also we have an office in New York, but which we collaborate about South-South cooperation, especially among not only Africa, but South-South could go to India, other countries, but to learn from each other. So this is something also as a UN and the country office, we try to look at in terms of how can we accelerate development, how can we learn from each other. Sometimes we don't have to reinvent the wheel, and sometimes people can learn a lot from Liberia, but also Liberia would learn from others. So I think as a general introduction, I will leave it to that, and I think I would ask if it won't take so long for agencies to really deep dive on what they see as the key priorities. But for the moment, we are all now preoccupied in supporting the National Development Plan, because not only because we sit at the different committees, steering committee, coordination committees, because we know this is where the future we will align our work with. And so this is very important in guiding our work. But as we wait, we work according to the adjusting the current program to the 100 and short-term plan of the nation. And so I will really ask the agencies to quickly, point out a few key issues. I see from the agenda already, you mentioned disability. In the intervention, when UNDP will be talking, they will deep dive a bit on that, because they're the lead agency, although all of us with the leave no one behind, all of us have to do something on disability. Nutrition, UNICEF will say more about that on our side. I am sure if the other agencies that work on food were here will also emphasize on that. Youth empowerment, we'll ask our colleague UNFPA to speak more about that. But we know that even beyond this, there is a lot that you do on promoting private sector and investments, innovation, technology, energy, the economic impacts from small business. And when we read, we feel that there is a lot that you do in terms of supporting women, entrepreneurs. So anyway, we will do a tour de table, they call it in French, and then we will.
Thank you. Thank you, RC, and thank you, Excellency. Maybe the first thing I would say is to congratulate you, because you fulfilled the pledge you made. I think the first time we met with the leadership of the Women's Legislative Caucus, you said that you were working to make sure that Member County had a woman as a superintendent, and it came to pass. So congratulations, and that makes me feel that you are a true advocate of the issues that UN Women works for, which is women's empowerment and gender equality. And just to encourage and let you know that we're here to support you to ensure women's representation and participation in all the areas. But just two quick points I just wanted to flag was a very interesting initiative we're doing with the Central Bank of Liberia to promote financial inclusion for women, and so women in Koung and Nimba County. So we're supporting digitization of some of the VSLAs in these counties that we work for, doing that in conjunction with the Central Bank of Liberia. So I think that's something that has a potential also for scalability and perhaps at the appropriate time, together with the governor of the central bank, we'll be able to give you some more information on that. And just also to mention in the field of private sector development also, UN Women supports the women's empowerment principles. So a set of 7 principles geared to the private sector to support the private sector to look at addressing issues of gender, everything from their own policies to representation of women in the private sector. And we've had some conversations with the Chamber of Commerce here on that and had a convening, and it would be great to see how we can work with you to also champion the women's empowerment principles and the work with the private sector in Liberia as well. Those are just the 2 points I'd like to raise for now. Thank you.
Thank you, Excellency. UNDP, we support the country across a broad swath of the governance dimension, institutional reform, capacity building, rule of law issues. We also do support the country in environment, climate dimension, which is the new goal for most countries. And our hope is to ensure that we have the right regulatory and institutional framework to also benefit whilst promoting from the environment. I'll just end by highlighting one of the agenda items, disability rights and inclusion. I think there is a bigger UN mandate for all countries to not leave anyone behind. My colleague talked about women, and I think among the populations also we have people with disabilities. We've helped the country to develop a national action plan, and I think the key for us is to basically ensure that it's rolled out, it's implemented, among other things, including improving access across the board, access to buildings, access to education, to health, to economic ventures and enterprises. And so we look forward really to engaging you to ensure that the National Action Plan is rolled out and everybody, all Liberians, are involved in the development process. Thank you.
Yes, good afternoon. My name is Kasai again. I'm from WFP, Deputy Representative. So from our side, we are also supporting a value chain through the homegrown school feeding program, where we support the smallholder farmers on the production of rice, gari, cassava, and beans, and palm oil, where we use those foods for the school meal program. So we create support to the homes, the smallholder farmers, and also we also created some the rice and gari processes where they can also pass through, and then until they reach to also the school meal, where we create also a market for the smallholder farmers. So even if it's a low scale, but we are working out on the scaling up both the homegrown school feeding program, where we wanted to really just scale up, because currently it's only 18% of the school, the children in need of the supposed to go to the school, and when they are not supported. So we are also working more on the institutional capacity strengthening for development. So recently we supported the zero post-harvest loss to strategic development to the Ministry of Agriculture. So The other part where we are also working is just supporting the government on managing the medical store, the central medical store warehouses, where we support managing that, and also for the last mile distribution of medicine, we just supporting service provisions. So they also have the school gardening, which is really linked to the nutrition, and also for the children to have diversified food from the school garden.
Good afternoon again, Your Excellency. So you're familiar with UNFPA, but just again as a high level. In Liberia, we are working very closely with the Ministry of Health to end preventable maternal deaths, which I know you yourself are particularly interested in as well. So we work on system strengthening, but we also work on training midwives, specialized obstetric care, for example, fistula treatment and management. We work also to ensure that access to family planning is there throughout the country. So we procure reproductive health commodities for the Ministry of Health for distribution across the country, but we also really focus our program on adolescents and young people with a view to reducing teenage pregnancy. So to ensure that they avoid unintended pregnancies too early, they stay in school, complete their education and skilling. And then of course we support the Ministry of Gender and Health on provision of services for survivors of sexual and gender-based violence and harmful practices through integrated one-stop centers and safe homes. But underpinning of course all of this is the work that we do on large-scale data analysis and surveys which help the government to really inform policies and programs, for example, the census, the demographic health survey. We're supporting Ministry of Gender with the information management system on gender-based violence. So there's a lot of work that we do on data and helping to understand the population dynamics and trends, which can then inform national policies and national programs. So for example, with the Ministry of Youth and Sports, we'll be now supporting them to do revise the National Youth Policy and the National Action Plan on Youth, Peace and Security. So that's UNFPA. On the youth empowerment, specifically on at-risk youth, again we work collectively across many UN agencies. Almost all have a specific emphasis on young people and youth, especially given Liberia's the population trends that you have, with 75% under the age of 35. So across the agencies, we work on education for youth, health, gender equality, skills and employment across the various agencies. We have, under the RC's purview, set up a youth advisory panel for the UN agencies. So they are young people who we try to involve very consciously into our program designs, our policies, and they also learn. It's also an opportunity for them to learn. So this is 15 young people who've come together and we formed a youth advisory panel for the RC and the UNCT. We also have joint programs that we undertake. Specifically, I'll talk about the program that we have for at-risk youth or substance-using youth. Initially, this was a joint program between UNDP and UNFPA, which then helped inform the design of the national program, which was designed by the previous government, but in collaboration with UN agencies beyond even UNDP and UNFPA. And we currently have a program which is UNICEF, WHO, UNDP and UNFPA, but we also have UNODC and UNIDO, who are already doing work which impact this particular group. The program is, it looks at 3 buckets. It really looks at prevention. It looks at prevention starting from in school. So how do you spread awareness and increase awareness amongst young people about harmful substances, gateway drugs, and help them to prevent even starting their experimentation and use. It focuses very much on treatment and de-addiction for young people who are already using substances. And then the third pillar focuses really on rehabilitation and reintegration back into society through giving them the right kind of skills and employment opportunities, whether it's jobs or setting up their own enterprises. So of course we can discuss that more with you. We are working closely with Ministry of Health and Youth and Sports on that.
Okay, thank you very much. So I will try to present WHO, a summary of what WHO does on behalf of the WHO representative. So as the name implies, WHO is the World Health Organization. So our focus in Liberia is on the health sector. We work closely with that sector from the level of the Minister of Health to the service delivery components, the service delivery areas, that's the counties, and lower down to the communities and the districts. So in there, our focus is on health system strengthening and attainment of universal health coverage with the objective of ensuring equity and equal access so that no one is left behind in terms of being able to access essential health services. So towards this, WHO has presence in nearly all of the counties. We have field presence currently in 13 of the 15 counties, and the organization is endeavoring to employ for the other 2 counties, that's for Pangibi and for Grand Crew, to be able to work with the county health teams and the local government from the superintendent down to ensure that health services are made available as close to the people as possible as can be had. The next area of focus is with health security in terms of preparing Liberia to be able to prevent, detect, and respond to health emergencies. For example, the Ebola outbreak that was successfully contained some years ago, and then currently the COVID. WHO is central to all of these. So we have a pillar big on ensuring that Liberia is protected from health emergencies as well as non-health emergencies in collaboration with other partners. Our third area of focus is what we term ensuring the health and well-being of the population, healthier population and well-being. Here we focus on the social determinants of health. And this includes, in the videos that we'll talk more, WASH a little bit. We look at WASH in healthcare facilities because we know that infection prevention, you can't do that very well without ensuring that there's some source of safe water for safe service delivery. So WASH is an area that we focus on. Nutrition is another area that we also focus on. And then ensuring that people have strategic information to make decisions to seek health and when to seek health. So social behavioral change and communication, we also invest in it to ensure that everyone is empowered to be able to access health care. So principally, this is what we do. And in terms of the frameworks, we have all of our frameworks that guides what the WHO does. At the level of Liberia, we have what we call country cooperation strategy. We have one that's in there from 2022 to 2026. So that current one is like our Bible. It guides how the WHO works in the country with the government. That has been approved and is also being implemented. So maybe in summary, this is WHO. Thank you very much.
Thank you. Good afternoon, Honorable Vice President. Good afternoon. UNICEF supported part of the UN cooperation framework in Liberia is focusing on few key areas. In the health sector, say immunization, community health, neonatal care. In the nutrition sector, we are focusing both on prevention and treatment, coordination, and surveillance system. I will come very shortly and end on this. In the WASH sector, UNICEF is supporting stopping open defecation, mainly in rural areas. As my colleague Dr. Musu mentioned, WASH facilities in institutions, this means health system and the schools. In the education sector, we are working closely with the Minister of Education, both on access and quality. For child protection, our focus areas are birth registration, ending violence against children, and child justice. We are working closely with Minister of Health, Minister of Gender, Child Protection, Minister of Justice, WASH Commission, Minister of Youth and Sport, and Minister of Education. Coming to the nutrition part and the SUN movement, it's really an opportunity for me, following my RC, to say thank you for the strong leadership you show, putting nutrition and the SUN on the top of the agenda of the Republic of Liberia, and finding time to go outside the country to bring successful experiences. In the SUN movement, UN agencies working on nutrition support the government of Liberia. Support the government of Liberia show the way to go, to put in place a multi-sectorial. This is really key. Is the Bible, is the Quran, is something to save children's life in this country. And is really not only showing the way forward, is really say how the government and government entities put national resources in this plan, and how convincing other stakeholders within UN and beyond to put life-saving actions to change the life of children. And nutrition is not about food, it's about present and future and potential of children, of the next generation. So it's really a development issue, and it's not only food issue. Thank you for guiding us on this very critical and strategic part of changing the future of this nation.
I provide strategic advice and guidance to both the UN and government on issues affecting peace and security, and work to support rebuilding of capacity for sustainable peace. And this is founded on understanding of the changing political insecurity and development dynamics in the country. More recently, I've been working closely with the KFL on integrating mental health and psychosocial support in the institution. We conducted an in-depth assessment of the issue in the AFL, and I'm happy to say that with the support of the Chief of Staff, the assessment report is available, and we're about to roll out the support model.
Thank you. Good afternoon again, my friends. And before I present the activities we are conducting here as Office of the High Commissioner for Human Rights, allow me to thank you again for accepting to launch the National Action Plan for Business and Human Rights in the country, following the discussion and everything we had last time. So thank you very much for that.
Thank you.
So the Office of the High Commissioner for Human Rights is a specialized UN agency for protection and promotion of human rights across the world. And in Liberia, we provide technical support and policy advisory support to government entities, and not only the Ministry of Justice, we also work with other ministries, including the Ministry of Labor, in the context of the National Action Plan on Business and Human Rights. For instance, we work a lot with the Ministry of Labor and the Ministry of Justice and other ministries. We also support a lot the National Human Rights Commission and other integrity institutions such as the Liberia Anti-Corruption Commission and the National Disability Commission. And at the level of UN agencies, we are also, our work is also to make sure that other colleagues, UN agency colleagues, apply the human rights-based approach in everything they do, to ensure that the human rights is mainstream in the activities, programs, and projects of our colleagues. And finally, to put it short, is also to make sure that in providing support, we also ensure no one is left behind. So, and this is why in the work we do, we ensure that the government implements its international obligations, not only when it comes to a convention that the country ratified, and which oblige the country to draft reports. So we support the country to make sure that the country draft those reports. The implementation of the UPR recommendations, the UPR Universal Periodic Review of the country, which is a space where in Geneva all countries come together and provide recommendations to their peer, to the other country, and the country accept them and accept to implement them. In the case of Liberia last year, we are pleased to say that Liberia was among the rare countries when they went to Geneva in December to accept to implement, to pledge for the implementation of key issues, including the ratification of the death penalty convention here. And the country accepted to do it, and I think and I hope this year they're going to do it because the bill should be at the level of the Parliament and the Senate, I think. So we are hoping.
Including the death penalty, right?
Yes, and we hope that this will be done this year as pledged by the government. So in a nutshell, that is what we do here in terms of the work of the Office for the High Commissioner for Human Rights.
Thank you.
I should say that there are agencies that are not here. Oh.
Yeah, I'll be very brief. UNESCO, because nobody should be left behind. UNESCO is a lead agency in terms of encouraging access to quality and equitable education. And we know Liberia is among, the level of access in Liberia is almost the lowest in the world. We're trying to encourage and see whether we can move from that low level to acceptable levels in the world, across the region that we're in and also in the world. Currently, allow me just to talk because we are at all levels, basic education up to tertiary level, but allow me to just mention where we are active currently, which is in the Tibet subsector, supporting the government to govern, to manage, and to coordinate. Because we know that Tibet is very fragmented. We don't have policy guidelines. We do not have the policies there, the Tibet policy, which is in application 2022-2027. Quality guidelines, accreditation frameworks are not there. And so we're supporting to ensure that there is sanity in the Tibet subsector. Understanding that Liberia has about 75% of the young people, and most of them are not being able to access quality education, and we believe Tibet can propel them to get quality jobs, and they become employable. They get decent wages and they live decent lives. And so we, the OHCR has talked about human rights approach, and education is a human rights issue. And so we want to ensure that our children in Liberia are able to get to school and get quality education that can make them earn decently. Thank you very much.
Thank you.
Thank you. Thank you so much. There are agencies that are not here. UNHPA is actually slowing down because there's not a big population of refugees, so the head of agency is there, but there's a small office that is closing down. But IOM is here to follow up on any other population of concern, like people who are getting and trying to get Liberian citizens, people who are living here in one or another, but also the working on diaspora engagement. They are specialized in that. International Labour Organization, also not here, but they are non-resident, but they have actions here. UNIDO also working very closely with the Tibet. UNODC has a smaller office, but their regional office covers here, and they look at larger issues, including drug trafficking, crime, and stuff like that, which they follow up. So I think that's that. The the governance, people have not gone deep into what they do, but there's quite a lot on governance, on anti-corruption, transparency, but also on supporting bigger issues like elections and peace building, including social cohesion and other mechanisms to sustain peace. And we have a program based on the peace building fund, because Liberia also still under the peace building configuration. So I think we could go on and on, but we still align to the national priorities, but also because Liberia is a member state of the UN, to the Sustainable Development Goals and to the Agenda 2063 of the African Union. And maybe I will just conclude by saying that going forward, and we are working very closely with the national development process to see that the member states have said that there are 6 areas to focus on to make a move on the SDGs. Because the SDGs are at risk of not being achieved. So food systems, and that's why when we were launching the National Food and Agriculture Plan, I mentioned it, it's a priority that all countries have said agriculture and food system is a priority. Climate change, biodiversity, jobs and social protection, education, and I think it's also a priority in this country, energy, access and affordability, digital connectivity. There are many more priorities, but these, and when you see them, luckily somehow they find themselves in the arrest and other documents. So we believe that the new national plan that will come will also align to the global priorities that you have. You are a member state and you make contributions in these decisions. So we're here as the UN to just make sure that Liberia also links up with international commitments and obligations. I'll stop here. We could go on and on, but we would like to hear from you.
Thank you. All right, thank you so much for your deliberations. For me, I think we can just go on and go down and listen to the beautiful projects you have to support the government. And you're excellent. Thank you so much. We will now turn to the Vice President to also share his view on issues we have raised in response to your deliberation. Thank you.
Thank you so much. So let me say thanks for the brief information. Now we learn a lot from it. Again, I bring you greetings from the President, President Waka, who is committed to inclusive development at all levels, leaving no barriers, which most of you will also champion. And so I wanted to thank you for supporting the President's agenda, the arrest agenda. You know the arrest agenda has to do with agriculture, number one. They launched the agriculture action plan today. We want to grow what we eat here because we depend a lot on food from out. As we speak, the issue of rice is becoming an issue. And then the Indian government have added 20% tax on export of rice. So we need to start to grow. We have good soil, we need to start to grow here. I want to thank you, all of you, who help in the agriculture. Roads network, and most of you into roads to help in the road. Helping our people to bring their crops from the market, from the farm to the market. I'd like to say thank you for that. The rule of law, the UNDP and other people working with rule of law, corruption, and other issues. Education, UNICEF and other people in education helping our children. Sanitation, health, and tourism. My office, this is generally for the country, but under my office we have the people with disabilities, the group of 77, and other disability organizations across the country. We are looking forward to working with you, see how we can help them. Just yesterday, my wife is a coordinator, under our law, the wife of the Vice President is the coordinator for the group of 77. Group of 77 are people born with disabilities. There are people who encounter disability while growing up, but there are people who are born with it. And so there's an office space somewhere on Newport Street. And that office was very bad when we took over. I mean, children in class, they raining on them, and they sleeping in water or in the room, and then they even killed a pregnant woman. And so my wife took over, she had to renovate that place. Yesterday, fortunately, she dedicated it. And so we are having some school there. We look forward to working with those of you in line with people with disabilities, how we can help them, train them. As you can see, most of them in the street begging. We want to make sure they leave the street and they can do something for themselves. So there's a whole program she's working on. She got Jacob here to work along with her. And so we'll also maybe formally communicate to the agency responsible for helping in those directions. We'll work with you on that. We also have nutrition and food security. Like you said, nutrition is not only food. They have to do with health issues too, because when people are on that good nutrition, people are healthy, the body can resist some form of disease that come around. And so we'll also be looking at working with the agency responsible for nutrition. I know the Son Secretary is here. They're working very closely with them. Youth empowerment, they are rich youth. You can see a lot of them in our street and every day. The president declared war on drugs. Declared drugs as an emergency, national emergency. And so we are equally working on that. We look forward to working with agencies that are responsible and that they are core in this area. Yesterday, I was privileged to be in a meeting with the UNFPA and youth, and something shocked me that 3 women die every day in Liberia from giving birth. I think it's a serious issue. No woman should die at this time. And so most time in the interior, there's a system designed that where you got clinic, there's a maternal waiting room built there, supported by you, by the community, by the government. And so when a woman gets pregnant, she have to, at certain, maybe 3-4 months, she have to move to that village where the clinic is. It started well, but we started having some problem with it. On ground that most time the women leave and the husband get another woman. And so because of that, most women are not moving to the maternal waiting room. So your life is at risk, but you equally don't want to, after birth, you come home and you can't go home, your husband got another person. As much as we are talking to the men, it's a difficult thing. And so I was thinking, those involved with health, whether we can take medication to pregnant women in the various location. Since it's not, if you are sick,